Hi, I'm with Peter Kirwan from Sports Rehab Clinic in Kill, and I'm Irene Tracy from Smovey Health, and these are Smovey, Austrian exercise and wellness tools, and Peter used them in his physio practice in Kill. Peter, can you tell us how you use the Smovey rings, please?
Suppose different ways, as I said, introducing, been using Smovies the last 6 months, and I find them on several different ways of good ways to use them. And I find from the treatment point of view, just using them for maybe warming up the client to get in deeper tissue. Because a lot of people at the moment, when they get in on the muscles, to really relax the muscles, and the only way you can relax the muscles, I feel, by using the Smovey. You know, some people I feel at the moment treatments, they're going in too hard, too vigorous from the start. So this is a very, very good tool to really relax the muscles. So again, just John here, work colleague of mine, so we're just going to just show someone if come in with typical static nerve problem down the leg, which commonly would be 60-70% of my treatments that I would do. So it's a very, very common one. So basically, the starting on the route, basically is to get the balls moving over and backwards. It's mainly starting on the lower back, because obviously this is where the sciatic nerve is being caught in the sacroiliac joint and SI joint here. And obviously going to start there and going to work the whole way down the sciatic chain. And can you feel that, John? Yeah. So just make sure you talk to your client and that you're not pressing down too hard. So it's not vigorous pressure downwards. So it's nice movements over and back. Okay. So it's not strenuous. It's obviously good for the physio as well as the client. So it's easy on everybody. Okay. It's starting off. So basically, just going to stay around here. Then we're going to start working down the sciatic nerve. The people that don't know where the sciatic nerve comes, it always shoots down across here, comes right down into the middle of the hamstring, and comes right down to the calf here and branches out here, coming down here. So typical, anybody will always say, oh, I've pain in my calf. A lot of time it's coming from a sciatic nerve, or somebody comes into you saying they have a tight hamstring or a pulled hamstring. A lot of the times, I would say 90%, 80% of would be trapped nerve shooting from this area here. So just come down by the piriformis here. This is where the sciatic nerve shoots right in beside the piriformis. A lot of people sitting in office work, sedentary, very tight hip flexor muscles obviously would work on it as well. So after this, you obviously want to work on the hip flexor muscles to release them, because people, sedentary lives at the moment, sitting down every day between driving and office work and that. So as we're working down, just keep asking the client, John, how do you feel that? Yeah, so come right down on the sciatic nerve. I like to kind of just come across the sciatic nerve. That's really because the vibrations just go very, very deep. So they go in a good few inches right into the nerve, you know. So really want to try to really relax the nerve, because the muscles, a lot of times the hamstrings get very, very tight and really squeezes in on the sciatic nerve. So really shooting down the back of the leg here. Also, when I'm working down here, the lymphatic system works. So you have lymph nodes right at the back of the knee here. So we're also just going to release them as well. This also works for people, lymphatic system as well. It's super to work down the leg as well, to up and down. So somebody's not in a wheelchair situation or doing all the walking, or someone's in hospital a while, it's a very good tool to relax them as well, you know, to keep that lymphatic system working, because it's so important, because obviously if they're sick, all the toxins are holding in their body, and you just want to keep draining out the lymphatic system. So just working down here, just following that nerve the whole way down, working down by the Achilles tendon. And obviously let's take off the shoe down with the client. And hopefully then they haven't smell off their socks. So working the whole way down then, so right, because the nerve comes right down to the big toe, so always the nerve endings will always come to the right to the big toe. So I like to follow that nerve the whole way down. So if you're doing this, coming like this angle, I prefer to come at this angle, so come straight across rather than trying to come at this. So this is a lot more easier. So you don't have to be pressing hard, as you can see. You don't have to be pressing down hard on. So then we're going to work slowly back up again. And I like to keep the hands good and straight, so you're not always working on your wrist muscles, because obviously us physios have been at this for 25, 26 years now. So the wrists do get sore, so trying to keep the wrist as stable as you can and working the bigger muscles from your shoulders. So this is the most common point here for sciatic nerve. If I really was working trigger point, this is the main point I would work on with some sciatic nerve. And if we really work hard in this area here, because these are a few trigger points that the sciatic nerve really, really stimulates, you know. So just working back up again. And usually you're getting your own treatment yourself as well, because the vibrations going through your hands. So the two of us are getting the treatment at the moment, you know. So really, because I've obviously, my fingers now are obviously arthritic, all the years been doing physio. So I get massive relief from that arthritic pain in my hands once I start doing the...
Yeah, I even have a lot of physios who use this themselves. Some don't necessarily take it into their own practice yet, because they haven't the training done, but they find it great release for their own hands.
Yeah, fantastic. And it's a great tool, you know, even for, as I said, working on kids at home or and that for relaxing to go to sleep and that. I just find it in my own kids to make them tired at night and before they go to really relaxes down and stuff. And even ourselves, we can just massage ourselves with it, you know. So just going back up now, right up onto the nerve again. So we paced, that took about 5 minutes to kind of go up and down there. And this would be another massive trigger point here on the periformis. And because this is where the nerve gets caught, okay? So mostly this is just the most important point. So I would say here, here, and here, they'd be the 3 points that I really concentrate on if it's working on it. And so then slowly working up, back up along here, okay? Then working on both sides, you know? Because obviously his SI joint is going to be out of line because the nerve is pinched, so you want to work here. So then, look, then you do a small bit of manipulating later on, but this is getting the tool people ready for the next movement, okay? And then probably after that, then I use my dry needles then to work down on the nerve then as well, okay? But this, I have to say, fantastic tool to really relax the muscles, to relax the nerve. It's all about relaxing the nerve. As you can see here already today, a guy with Parkinson's, massive results from again. So it really, really stimulates the nerve and relaxes the muscles around the nerve.